Hello everyone, my name is Captain Nitish Arora. Welcome to my channel. And today this video, मैम का मैं बहुत शुक्रगुजार हूँ. मैम ने मेरे को परमिशन दिया इस वीडियो के लिए. And this is for those students who want to get into the field of aviation and we have doubts related to the medicals, जो कि सबसे important doubts हैं. तो मैं आज मैम के पास आया हूँ यही doubts आप लोगों के लिए clear करने. And मैं ज़्यादा time waste नहीं करूँगा. Just I'll ask ma'am for the introduction and then we'll start the video.
Hello everyone, I'm Dr. Puneeta Masrani. I'm an aviation medical specialist and I'm a class 1 medical examiner with DGCA.
And ma'am, apart from DGCA, do you do any other countries' aviation medicals also?
Yes, I do them for the FAA, the USA, Transport Canada, EASA and all European countries.
Okay.
Qatar Civil Aviation Authority, South African Civil Aviation Authority, GCA Aviation Medical Authority at Dubai, with CASA Australia, with CAA New Zealand, and of course
I think globe कम पड़ जाएगा इस सब के लिए. तो ठीक है. So ma'am's name is there on the DGCA list and you can find out at the name of Dr. Puneeta Masrani, VM Medical Center at Worli. So you do both class 2 and class 1 medical examiners, medicals?
Yes, we do class 1, 2 and 3, which includes cabin crew and ATCOs also.
Okay.
However, for some regulatory authorities including DGCA, Qatar, Europe and UAE, we do class 1 renewals, not initials. For all other countries that I am designated with, we do initials and renewals.
Okay, great. So ma'am, first thing is जो main बच्चों को doubt रहता है कि what are the basic requirements for the class 2 medicals and class 1 तो जिसका class 2 clear होगा वही कर सकता है. तो basic requirement क्या है, like age requirement, height requirement, weight requirement, वो कैसे workout होता है? Is there any prescribed performer उसका है या और क्या चीज़ है?
So as long as the DGCA class 2 medical is concerned, we require the 10 standard mark sheet, which means the child should be 16, 17 minimum. It's not by the age, the medical goes by the 10 standard mark sheet because that's a mandatory document for applying for a class 2 medical. There is no upper age limit to do a medical exam. There may be age limits for job employment, but not specifically for the medical examinations. As long as height and weight is concerned, again, there is no prescribed minimum or maximum height and weight. The important thing is that the person should be able to reach all the controls adequately while performing all duties in the aircraft, whether in a routine flying or in an emergency, with of course the seat adjustments that are there in most trainer and jet aircrafts. Having said that, at the time of a medical, if the examiner realizes that the height is probably too less or too much, then we ask for a cockpit test evaluation, which means we put you in an actual practical environment in a simulator or in a trainer cockpit to assess your ability to be able to reach the controls adequately. And if you are able to perform that, then you could be accepted. And of course, this will be documented in your medical records. The other thing about height and everything is that because you've cleared the DGCA, that doesn't mean that you would be accepted for employment. So anybody who has extremes of height or weight may want to keep that in mind, that employment could become an issue. But of course, we know lots of people who are flying, outside the usually what you think would be acceptable, but no, there are a lot of people with lesser height also flying. So you should definitely get yourself evaluated.
Okay. And anything about the weight or the BMI?
Weight, we don't have any minimum or maximum criteria for the weight. We want to see why are you probably underweight or overweight. Is there any underlying metabolic condition or any disease or anything which keeps you outside the normal BMI range. So when you come for the medical, we evaluate you for those conditions. There are some extra tests that your examiner will ask you to undergo. And if those reports are satisfactory, there is no major condition found that is a problem in flying, then you could be accepted.
Okay, great. And मैम जो एक सबसे ज़्यादा डर रहता है बच्चों के माइंड में, that is permanent unfitness. तो आपका उसके ऊपर क्या कहना है कि परमानेंट अनफिट्स, आर देयर एनी स्पेसिफिक कॉजेज व्हिच कॉजेज द परमानेंट अनफिटनेस, या कुछ ऐसे डिजीजेस हैं, कोई लिस्ट है ऐसी डीजीसी के द्वारा या?
Yeah, so DGCA has not published any specific list of any disqualifying medical conditions or conditions that make you permanently unfit. I think each case is basically taken on its merit on a case-to-case basis. The best person usually to guide you is your aviation medical examiner, where if whatever the condition, whatever the medical problem that you may have, you will first be evaluated for that medical problem. Also the causes for that medical problem. And depending on the cause, depending on what treatment options are there, how you're responding to the treatment, whether the risk is acceptable. So keeping all this into consideration, every case is taken on its merit, on a case-to-case basis. The decision is always made by the DGCA medical cell, which is at Delhi. You might be required to go to an Air Force boarding center to be evaluated, and then a decision is taken. The system will take all fairness and into account all aspects before a decision of permanent unfitness has been made, whether at initial or at renewal or at any time in your medicals.
Okay, and any particular time period for the temporary unfit?
Temporary unfit, an applicant could be made temporary unfit if there is a condition which does not meet the DGCA medical requirements. Again, the examiner would evaluate you in detail as to what is the cause of the problem, if there is any further underlying cause which is leading to that problem. And the period of unfitness will actually depend on entirely what the problem is and the treatment that is required. It could be as short as a week, it could take a couple of months. It depends on the condition, whether it's just an infection, it's a blood or urine infection, or is it high blood pressure, or is it a kidney stone. So it entirely depends on the condition, and depending on that, the examiner will always tell you what is the period of unfitness. Also, usually after a period of unfitness, your evaluation will then be done at an Air Force boarding center.
So, ma'am, there are a lot of myths जो students के mind में रहते हैं, like related to spectacles and any other things की, तो उसके ऊपर आपका क्या कहना है? A lot of myths जो student एक as a fresher जो student आ रहा है, 17-18 साल का बच्चा आ रहा है, तो उनके मन में ये रहता है कि स्पेक्टिकल्स हैं, या और भी बहुत सारे मिथ्स रहते हैं, मेरे को डायबिटीज है, मेरे को हाई ब्लड प्रेशर है, तो क्या मैं उनकी वजह से पायलट बन पाऊंगा, नहीं बन पाऊंगा? हाइट का आपने ऑलरेडी मेंशन कर दिया, वेट का आपने ऑलरेडी मेंशन कर दिया. व्हाट ऑल अदर मिथ्स अकॉर्डिंग टू यू आर देयर कि जिसकी वजह से जो मींस एक र्यूमर की तरफ फैलते हैं? व्हाट अकॉर्डिंग टू यू आर दोस?
So basically it is you may believe that fit होगा, अनफिट होगा. एक बात सबसे पहले समझनी बहुत ज़्यादा ज़रूरत है कि एविएशन एक सेफ्टी सेंसिटिव एक्टिविटी है जिसमें सेफ्टी की बहुत ज़्यादा प्रायोरिटी होती है. Anything that impacts safety is going to be given its due consideration. So if your health is going to impact safety, then it could be an issue. If your health is not going to impact safety, even if you have that medical problem, we are not worried. तो आपकी again condition क्या है? जैसे if you're wearing glasses are acceptable, provided with the glasses you are able to meet the DGCA requirements of 6'9" each eye, 6'6" each eye for class 1. Also, there should be no underlying pathology in the eyes. Similarly, you could have ECG abnormalities, but there should be no underlying cardiovascular pathology. You could be having hypertension, but there should be no other underlying cause of the hypertension which cannot be treated. Or if it can be treated with medication without any significant side effects, you should be able to be treated. So, if you have any medical condition, discuss with an AME and the person will be able to guide you, because again it depends on a case-to-case basis. But definitely I can say glasses are allowed, LASIK is allowed. A lot of medical conditions are now allowed, but they always have to be evaluated, they have to be documented, they have to be reviewed on a periodic basis so that we are certain that at no stage are you getting into a condition which can affect safety. That's always the bottom line when we take decisions.
बिकॉज काफ़ी सारे बच्चे मेरे को पूछते हैं कि मेरी बैक पेन है, तो आई डोंट थिंक सो कि बैक पेन का इज एनीथिंग, तो आप थोड़ी देर खड़े रहोगे तो बैक पेन वैसे भी हो जाएगा आपका.
करेक्ट. अगेन एज आई सेड, इट ऑल डिपेंड्स ऑन द कॉज. आपके बैड पोस्चर की वजह से बैक पेन है, या आपको स्पाइनल डिजीज की वजह से बैक पेन है, या आपको कैल्शियम डेफिशिएंसी की वजह से बैक पेन है. तो पहले तो वो कॉज जानना बहुत जरूरी है. वो कॉज को कैसे ट्रीट किया जाए वो जानना जरूरी है. वो ट्रीटमेंट की वजह से तो कोई प्रॉब्लम नहीं हो रही है. जैसे आपको जुकाम हो गया, आपने एंटी एलर्जिक मेडिकेशन लिख लिया, जुकाम तो ठीक हो जाएगा, लेकिन उससे एंटी एलर्जिक मेडिकेशंस कई ऐसे होते हैं जिससे नींद आती है, थोड़ा स्लो हो जाते हैं आपके जो रिएक्शन टाइम है, आपका डिसीजन मेकिंग है, तो स्लो हो जाता है. तो भले ही आपका कोल्ड ठीक हो गया हो, लेकिन वो दवाई की साइड इफेक्ट्स की वजह से सेफ्टी में इश्यू आ सकती है. तो ये हमें समझना बहुत ज़रूरी है कि सिर्फ डायग्नोसिस से डिसीजन नहीं लिया जाता है, उसका अंडरलाइन कॉज और उसकी ट्रीटमेंट, इन दोनों का इम्पैक्ट होता है डिसीजन पे.
So it's always better to consult your aviation medical examiner.
Yes, because they would be able to guide you. It is okay to go to your clinical doctor for your treatment, but from the aviation fitness point of view, always it will be your aviation medical examiner who will be able to guide you. Of course, there is a lot of literature available, especially all the AICs and the CARs by the DGCA. So they can always refer to. They give a lot of details. They always explain as to what is the requirement and what will be accepted and not accepted. But if you don't understand what that means, we are always here to guide you and help you.
So definitely, ma'am. And ma'am, how much time does it take for the medical fully to complete, and how much time it takes for the certificates and the validity of the medicals?
So a class 2 medical is what you begin with always. Like in my clinic, we have all the facilities in-house. We are an NABH accredited center. So typically we complete the entire medical in about half a day. The reports are ready the same day, and if the reports are all normal and you meet the medical requirements, you can upload the reports on the same day on EGCA, and we issue the CA35 to you. Once we submit your medical online on EGCA, it is then with the DMS Civil Aviation at DGCA, and they would subsequently clear your medical and you would be issued a medical assessment. The CA35 that we issue has a validity of 90 days, and definitely within that time you always get your medical assessment from the DGCA. Now in case you do not meet medical requirements, then as an examiner we would explain to you what our concerns are, what you need to do next. Maybe you need to get some treatment, maybe you need to go to a specialist for an opinion, maybe you need to do further tests for us to be able to come to a more definitive diagnosis. Now again, this could take a few days to a few weeks depending on where you are and what exactly the condition is. Based on that, it could take some time. And in these cases, as examiners, we may have to either make you temporary unfit, and the decision is then taken by the DGCA. If it's not a fitness case, then we may not be able to give you the CA35, and the decision then will be taken either by DGCA headquarters or at the Air Force boarding center. And at the time of the medical, you would be explained that.
Okay, and the validity of the medical reports जो students करते हैं, so let's say if some of the values are coming not right, तो कुछ values में ऊपर नीचे है, तो then the report validity is for how much time?
So the typical time period for report validity is 30 days, and when I say 30 days, we are talking about your blood work, your ECG, X-ray, audiometry. When we talk about ultrasound, 2D echo, stress test, or any specialized investigation, specialist opinions, these have a validity of 60 days. So we encourage you that whatever assessment, evaluation, treatment, whatever you have to do, you come back to the examiner in this period so that all the other reports that were done on day one itself can still be used and a decision can be taken. But if you do not come for a very long period, then those reports become invalid and you actually might have to start the whole process again.
Generally, people become lazy. I know a lot of students. So एक बार हो गया, अच्छा सर अभी 20 दिन बाद जाऊँगा, 25 दिन बाद अभी टाइम नहीं मिला, तो they become lazy sometimes, and that is why I asked you this question कि उनकी validity कितनी रहती है. And thank you so much, ma'am, for the beautiful video. And thank you so much for accepting my request. we'll just have a quick tour for your facility so that people can know what all facilities are available. I think all the medical tests are done here only. The
Yes.
students doesn't have to go to anywhere outside for any of the tests.
No, we do everything in-house itself. We have our own laboratory where all the blood work that is required for the medicals is done in-house. We have ECG, X-ray, audiometry, ultrasound, 2D echo, stress test. We also have specialists who come to us on different time slots. We have cardiologist, ophthalmologist, ENT, endocrinologist, gynecologist, and a dermatologist. So usually if you do require the opinion of any of these specialists, even a gastroenterologist, very often people need a GI opinion because fatty livers for some reason is very common in this age with high BMI and fatty livers. One of the
And
commonest
because of
thing
vada pav
that
also.
we see, correct. Mumbai has vada pav, when we see people from all over India having fatty livers. I'm not sure what they have. But yes, fatty liver is very common. It doesn't make you permanently unfit, but it depends on whether your liver function test is normal, whether you have any other cause of a fatty liver, or is it just obesity and bad eating habits. So we have a gastroenterologist also, whom you can take an opinion from, and that helps because especially for people who come from far distances or who come to us from outside India, it's very difficult for them to keep going to multiple places, multiple doctors at different times. So we make all those arrangements for you in-house itself, so that usually on the very same day itself your further evaluation can be done and a decision regarding your fitness can be taken.
Okay, I think that will be all, ma'am. Thank you so much for your valuable time.
Thank
And
you.
if you guys have any doubt or you have any queries related to the medicals, you can post it in the comment box, and I'll put the link for the ma'am's address. I think सबको मालूम ही है. It's available on the DGCA list, and I think it's number 18. 18?
Examiner number
Examiner number?
006.
006 on the DGCA's Western Region list.
Yes.
Okay, so you can find ma'am's name over there, address is over there. So, ma'am, how the students can take appointment for the class 2 medicals?
It's very simple. They can send us an email on pilotmedical1@gmail.com, or they could call on my landline number 02224901066, or they can visit my website www.onestopmedicals.in. Let us know that you want to come in, where are you coming from and when would you prefer, and we will give you the instructions and the appointment.
I think you guys will have very hassle-free work here क्योंकि मुझे तो EGC का कुछ मालूम ही नहीं था. I just came, ma'am reception पे जो ma'am थी, she just uploaded the things for me and everything was done very smoothly. Thank you so much, ma'am, for your valuable time.
Thank you.
Thank you so much. We'll come up with few more videos with interesting facts. Thank you.
Thank you.